Hi guys, we are Group 1. I'm Sandrina Mukatkat and my group mates are Arian Caballero, Eliza Asmin, and Stephanie Yap. And today we're going to report about developmental disabilities. So these are our table of content. So what is developmental disability? So developmental disabilities encompass a broad range of conditions that result from cognitive and or physical impairments. So they're identified before the age of 22 and usually last throughout the person's lifetime. So these disabilities include intellectual disabilities like cerebral palsy, autism spectrum disorder, Down syndrome, language and learning disorders, vision impairment, and hearing loss. So what are the causes of conditions such as cerebral palsy, autism, and hearing loss associated with developmental disability? Unfortunately, there is no easy answer. We're talking about a broad range of conditions, and this means a broad range of causal factors that often interact with one another. In general, causes are split across two domains, environmental and genetic. Let's start with environmental factors. So these can have an adverse effect of a child before, during, and after birth. So there are a variety of factors to consider, but for now, let's think about the most common. The first is nutritional deficiencies of both a mother during pregnancy and a child in an early development. Iodine deficiency, for example, is associated with congenital blindness, deafness, and intellectual impairments. So the second factor to consider is infection. Infections can damage a developing nervous system and cause a range of developmental disabilities. These infections can affect a child in utero, a possibility of a mother being infected while pregnant, or in a child's early years. But the common examples include a Zika virus, which can cause microcephaly meningitis, which may cause hearing loss, and measles, which may result in blindness. Another important point to consider is environmental toxins, which are well recognized to affect a developing nervous system. A child is commonly exposed to such toxins through a mother's health and behavior patterns during pregnancy, the most common of which would be consuming alcohol or drugs. Children may also ingest toxins once born, like lead, for example, that can be ingested through paint, batteries, and even gasoline. So these are the environmental factors we should be considering, but what about genetic factors? So congenital anomalies can occur as a result of genetic inheritance from one or both parents, or they may simply be spontaneous. So these genetic conditions will commonly cause syndromes that typically manifest as a group of identifying characteristics. The most commonly recognized of these is Down syndrome, which is caused by an additional copy of chromosome 21. However, there are many other syndromes caused by genetic conditions, such as Fragile X syndrome, Williams syndrome, and DiGeorge syndrome. Genetic syndromes and other genetic conditions can cause impairments across any domain, whether physical, intellectual, or sensory. When thinking further on the causes of a condition associated with developmental disability, it's important to consider that interaction between genetic causes and environmental factors may well increase the severity of impairments in children with genetic developmental disabilities, or they may produce comorbid conditions. So according to the WHO, 15% of the world's population live with a disability. This equates to 1 billion people, of whom at least 150 million are under the age of 18. Of this population, 80% live in low and middle income countries. As we have learned, the term developmental disabilities covers a broad range of conditions. And as this term is used differently across different settings, countries, and cultures, it is difficult to accurately estimate the number of children with developmental disabilities across the world. So first, in intellectual disability, there are 1 out of 6 children that will have an ID. Then the predominant sex that is most likely to have an ID is the male, that is 1.6 to 1 for mild ID and 1.2 to 1 for severe. So in the Philippines, 7.02% of the total population of persons with disabilities have ID. It's according to 2000 National Statistics Office census. So Next is for the cerebral palsy. Courtney. So next is cerebral palsy. The population-based studies is 1 to nearly 4 live births at per 1,000 children. So, there are like 3 children with ID in 1,008-year-old children. So the prevalence of CP is higher for children born preterm or at low birth weight. In ASD, or autism spectrum disorder, in 2020, the CDC reported that approximately 1 in 54 children in the US is diagnosed with an autism spectrum disorder. So boys are 4 times more likely to be diagnosed with autism than girls, and CDC estimate on autism prevalence increases by nearly 10% to 1 in 54 children in the United States. Next is Down syndrome. So Down syndrome continues to be the most common chromosomal disorder. According to the Down Syndrome Association of the Philippines Incorporated, or DSAPI, 1 is every 800 Filipino babies has Down syndrome. And with 1.5 million live births, this makes up about 1,875 new cases in the country. In fact, more than 100,000 Filipino families are living with a person with Down syndrome. Presently, there is no known cause, but some studies have linked that the mother's age is a factor, and that the risk increases as women get older. So next, so these are the charts, the statistics for the developmental disabilities. So from 1997 to 2017, the prevalence of any developmental disability significantly increased from 12.84% to 17.76%. So how early can a developmental disability be detected? So these symptoms may occur during infancy, or they may not be apparent before a child reaches school age. First, we will talk about intellectual disability. So the common signs include rolling over, sitting up, crawling, or walking slower than expected are some of the most common symptoms of intellectual disability. Speaking later than expected or having trouble talking. Slow to reach milestones in self-care, such as potty training, dressing, and self-feeding. So the pathomechanics, there's a global deficit in cognitive functioning. Deficits in adaptive functioning are expected, such as ability to communicate, socialize, and self-care skills or independent living. The 3 most common causes of IED are Down syndrome, Fragile X syndrome, and fetal alcohol syndrome. If IED reflects a loss of previously acquired intellectual skills, considered a comorbid neurocognitive disorder, it means that there is more than one disorder that is occurring in a person. In cerebral palsy, the symptoms we see are variations in muscle tone, such as being either too stiff or too floppy, lack of balance and muscle coordination, tremors and involuntary movements, learning difficulties, difficulty with fine motor skills, and seizures. So in pathomechanics, it explains that CP is the result of destructive and developmental mechanisms. So interruption of oxygen supply to the fetus and brain asphyxia were classically considered to be the main causal factors, explaining later CP. But clinically defined, birth injury or birth asphyxia count for a minority of cases of CP. So in autism spectrum disorder, the symptoms we see are abnormal body posturing or facial expressions, abnormal tone of voice, avoidance of eye contact or poor eye contact, behavioral disturbances, deficits in language comprehension, delay in learning to speak, flat or monotonous speech, inappropriate social interaction, intense focus on one topic, lack of empathy, lack of understanding in social cues. The pathomechanics of autism explains that autism does not have a clear unifying mechanisms at either the molecular, cellular, or systems levels. It is not known whether autism is a few disorders caused by mutations converging on a few common molecular pathways, or is a large set of disorders with diverse mechanisms. Autism appears to result from developmental factors that affect many or all functional brain systems, and to disturb the timing of brain development more than the final product. This anomaly appears to start a cascade of pathological events in the brain that are significantly influenced by environmental factors. Thus, after birth, the brains of children with autism tend to grow faster than usual, followed by normal or relatively slower growth in childhood. Hypotheses for the cellular molecular basis of pathological early overgrowth include the following: an excess of neurons that causes local overconnectivity in key brain regions, disturbed neuronal migration during early gestation, unbalanced excitatory inhibitory networks, abnormal formation of synapses and dendritic spines. So in Down syndrome, we can observe that they have a flattened face, especially the bridge of the nose, almond-shaped eyes that slant up, a short neck, small ears, a tongue that tends to stick out of the mouth, tiny white spots on the iris of the eye, small hands and feet, a single line across the palm of the hand, small pinky fingers that sometimes curve toward the thumb, poor muscle tone or loose joints, shorter in height as children and adults. So the pathomechanics, as with most conditions that result from chromosome imbalance, Down syndrome affects multiple systems and causes both structural and functional defects. Most affected people have some degree of cognitive impairment, ranging from severe to mild. Gross motor and language delays are so evident early in life, height is often reduced, and there is an increased risk of obesity. About 50% of affected neonates have congenital heart disease, ventricular septal defect, and interventricular canal defect are most common, and then about 5% affected people have gastrointestinal anomalies, particularly duodenal atresia, sometimes along with annular pancreas. So we're now going to talk about the types, course, and prognosis. So intellectual disability, so this is from cognitive disability, so under it is intellectual disability. So we define this as a cognitive disability that is defined as when one's cognitive ability is below average and has decreased ability to adapt to one's environment. So there are different causes for ID, which includes by following fetal alcohol syndrome and fetal alcohol effect. So, and then brain damage by using illegal drugs during pregnancy, genetic disorders, which include Down syndrome and Fragile X syndrome. So there are different grades or degrees of intellectual disability, which is determined or typically defined in terms of IQ. So these are the classifications of the MR or ID. So the mild, moderate, severe, and profound. So adults with ID can lead independent lives. However, children with a more severe grade of ID are more likely to have other disabilities, for example, hearing, visual, and a lot of more, and are usually dependent on others throughout their lives. The treatment for this is mostly non-medical. Therapy usually involves being able to achieve the maximal learning potential of the patient, exposing them to different social and recreational activities, as well as habilitation and vocational training. They have a life expectancy between ages 58 to 74, depending on the severity of the case. Next is we have motor disabilities. Under it is cerebral palsy. So we define cerebral palsy as a group of disorders that affects a person's mobility and balance as well as posture. It is also considered to be the most common motor disability in childhood. So these are many types of CP. So the monoplegia, which is one arm or one limb. Hemiplegia is one side of the body. Diplegia is symmetrical parts of the body, it's either the legs or the arms. And then the quadriplegia, where it affects all four limbs. In regards to treatment, there is no known medical treatment that can fully cure cerebral palsy, but only rehabilitation. So children with mild forms of CP have a normal life expectancy. Now, in behavioral disorders, it's under autism spectrum disorder. So ASD is a neurodevelopmental disorder that is characterized by difficulties in social communication as well as social interaction and restricted repetitive patterns in behaviors, interests, and activities. So there are many types of autism. There is autistic disorder, Asperger's syndrome, and pervasive developmental disorder. So let's start for autistic disorder. So it usually have significant language delays, social and communication challenges, and unusual behaviors and interests. Next is Asperger's syndrome, usually has milder symptoms of autistic disorder. They have social challenges as well as unusual behaviors and interests. However, they typing typically do not have problems in regards with language or intellectual disability. And lastly is pervasive developmental disability, also sometimes known as atypical autism. They are people who meet some of the criteria for Asperger's syndrome or autistic disorder, but not all are diagnosed with it. They have milder symptoms of autistic disorder, and symptoms might cause only social and communication challenges. There is no known medical cure to treat autism fully, though there are medications that have been used and shown to help reduce behavioral challenge and mood. So now we're going to talk about management, the medical and surgical. So ID, early identification, and early intervention are important right through a child's life. It can improve their conditions. This plan requires input from different care providers from multiple disciplines. Next is cerebral palsy. Surgery can help improve mobility, posture, and ensure healthy growth. PT and medication are also recommended. And lastly, autism spectrum disorder. There is no cure for this, but there are medications that can help. Other symptoms like seizures, depression, insomnia, and trouble focusing. Therapy is also highly recommended. So, management are critical members of the management team. So we have speech language pathologists. So this is us. So we are in charge of dysphagia and speech concerns. Then we have the physical therapist in charge of rehabilitating mobility, posture, and balance. Then we have the occupational therapist in charge of helping the patient transition and get used to day-to-day activities. Nurses cooperates and coordinates with the different disciplines to monitor the patient. And lastly, the doctors cooperates and coordinates with the different disciplines to create and monitor the patient's therapy plan.
Next, we have medical precautions during or regarding speech language therapy. Now, these are the medical precautions that an SLP must follow. First, we have hand hygiene. Of course, this is the most effective way to prevent infection. Next, we have isolation precautions taken in healthcare settings to prevent the spread of an infectious agent. Now, this is followed by SLPs who are working in hospitals. If ever they see an isolation sign in front of the door or the patient's door, they must go first to the nurse's station before they enter the patient's room. Next, we have personal protective equipment. This provides safety between the healthcare worker and the patient. Next, needle safety and sharp procedures or disposal. This is pretty self-explanatory. Sharp objects should always be kept away to avoid any accidents. And then lastly, we have patient care items and environmental services. Patient care items such as blood pressure cuffs, when SLPs would take the blood pressure of the patients, and also bedpans used in hospitals if the patient has the need to urinate. And also environmental surfaces. Of course, the environment must also need to be clean or in order to avoid any infections or illnesses. Now we have existing support systems in the country. There has been a study, which is the situation of children with disabilities in the Philippines study. It has emphasized that children with disabilities continue to experience barriers to access basic social services. So this is constituted by poverty, lack of data, weak governance, and also discrimination. Of course, we all know that in our society today, there is still discrimination against those people with disabilities. People still look down at those people who have disabilities. Now, the study has been supported by these three organizations, which is the Australian Embassy, the UNICEF, and DSWD. Now, the UNICEF has been working with PhilHealth in order to develop benefit packages for those children with disabilities. They also have been establishing children with disability hubs. So there are 3 in the Philippines that they have established, one for Luzon, Visayas, and Mindanao. And they are doing this in order to address the financial barriers that are preventing or hindering those children with disabilities from being recognized and treated. So it is their top priority to um, help those children with disabilities. Next, speech, language, hearing, and swallowing that may arise regarding the developmental disabilities. So I just chose 3 of the most common developmental disabilities, and ASD or autism spectrum disorder is the third most common developmental disability that exists. So those people with autism spectrum disorder, they're more likely to have sensory motor and coordination difficulties, which can result in difficulty in chewing and also swallowing. They may also have challenges with communication and social skills. Now, people with ASD or children with ASD, they tend to speak what is on their minds without any regards or consideration of those the feelings of others, and also the appropriateness of the situation or the environment. So that is why they usually have a hard time making friends, and they're usually isolated from the rest of the group. And some also talk very well, but some may not talk at all. This may be due to other cognitive disorders or disabilities. Next, which is the second most common developmental disability, which is cerebral palsy. Now, cerebral palsy often affects the language centers of the brain that controls speech. In severe cases, a child's ability to verbally express himself or herself might be seriously impeded. Meanwhile, in mild cases, those children with cerebral palsy may also, some may tend to correct themselves if they may express themselves wrongly or something like that. So in mild cases, they can still correct themselves. They have common feeding disorders and swallowing problems such as dysphagia that place them at risk for aspiration, which can also lead to um, pulmonary consequences. So of course, aspiration can also lead to lung lung illnesses or infections. Next, we have a significant percentage, which is about 15 to 25% of children with cerebral palsy, which also have some kind of hearing impairment. And we all know that those with hearing impairment, they tend to have difficulty in communicating or socializing with others, which can also result to isolation. And next, or which is the last one, this is the most common developmental disability, intellectual disability. So those people with intellectual disability, they are at risk for dysphagia. So they are people with intellectual disability. Their unique feeding and swallowing and also behavioral challenges are vital components in treatment or assessment because of the risk in dysphagia. Early detection of hearing loss and immediate intervention are imperatives for the cognitive, social, and vocational well-being. Speech communication is often troubled by disordered speech production and or impaired hearing. So of course, we all know that those people with hearing disabilities or impairment in hearing tend to have miscommunication with others and are also isolated and also impairment in social interaction. So they are still isolated from others. And that is it for discussion today. I hope you have learned something from it.